of us have heard about a procedure called as eye transplantation and eye donation. Now, do you know which part of the eye is actually taken and which is transplanted? It is not the whole eye that is taken out and it is implanted. In order to understand this, let's try to see this image. Now, this is an actual image of the eyeball, the section of the eyeball, and the most anterior portion that we can see, this is referred to as the cornea. And it is usually this cornea that is often implanted or transplanted, right? In order to understand different parts of the eyeball and their function, let's try to understand the anatomy of eyeball in this session. Let's focus on the detailed anatomy of the layers of the eyeball and its parts. The learning objectives for this session are, at the end of completing this session, you should be able to describe the exact location of the eyeball. You should be able to identify the three layers of the eyeball. You should be able to describe in brief the structure of each of these three layers. Let's begin with the location. We know that the eyeball is located in the orbit. But will it occupy the entire orbit? No. Remember, the eyeball occupies only anterior 2/3 of the orbit. Right? Part of the eyeball actually protrudes out of your orbit. Then you might wonder how this is protected. This is protected by the foreheads and also the nose. Right? These offer protection to the eye from external injury. So this is one important thing you need to know. The eyeballs do not occupy the entire extent of the orbit. Instead, they are located only in the anterior 2/3 of the bony orbit. Before we get into the details of the layers of the eyeball, let's focus on some of the important landmarks. If we draw the outline of the eyeball, we have the anterior portion which is referred to as the cornea, and then this extends as the sclera. Then there are inner layers. Let's not worry about it. And posteriorly we have the optic nerve. The entire eyeball looks like a ping pong ball. In fact, it looks like components of two different segments, two different round or sphere segments. These are, it has a posterior 5/6 and anterior 1/6 which is contributed by different segments. For example, this segment is contributed by the cornea, whereas the entire segment, the posterior 5/6, is contributed by the sclera. The entire eyeball measures about 24 millimeters in all directions. What do we mean by it? It measures about 24 millimeters in height, width and thickness. So this is one important measurement of the eyeball you want to remember, because based on this, we can define clinical conditions referred to as myopia or hypermetropia, right? Where the eyeball is too small or too large, resulting in visual defects, right? This is regarding the measurements. The anterior portion of the eyeball is referred to as the anterior pole, and similarly, the posterior is referred to as the posterior pole. The center of anterior curvature and posterior curvature can be referred to as anterior pole and posterior pole. Now, if you draw a line along the anterior pole and to cut through posterior pole, this is referred to as the optical axis. Now, why we need to know this? I'll repeat again. Optical axis passes from the anterior pole through the posterior pole. Then, this differs from one more term referred to as the visual axis. Now, how is this term different from optical axis? The term visual axis refers to a line that passes from the anterior pole to the fovea or foveola. Right? We will learn about what is foveola. So remember this important difference between the term optical axis and the term visual axis. Then we need to understand one more term, that is equator. What do we mean by the term equator? Equator refers to any plane that will divide the entire eyeball into an equal anterior half and a posterior half. Right? That is what we refer to as equator. Why we need to know regarding equator? In the topic of extraocular muscles, you will learn that the recti gets inserted in front of the equator and the obliques get attached behind the equator. So remember, equator is any plane that would divide your entire eyeball into an anterior half and posterior half. Equal anterior half and posterior half. Right? This is some of the basic things regarding the eyeball and its location. Once we know this, let's focus on identifying the layers of the eyeball. The entire eyeball in humans is made up of three distinct layers. Now, these layers are, this is also referred to as the outer tunic. This is the outermost layer or the first layer. Then we have the innermost layer. This is known as the middle tunic. Tunic is nothing but layer. Then we have the innermost. This is referred to as the third layer or the inner tunic. Let's try to understand how exactly these layers are formed. The outer tunic in its posterior part is formed by sclera. This is referred to as sclera. Then anteriorly it is cornea. So outer tunic is made up of sclera and cornea. Then comes the middle tunic. The middle tunic is also commonly referred to as the uveal tract. It is also known as uveal tract. It consists of three parts. What are they? This is known as the choroid. Here we have the ciliary body and this is the iris. Right? These are the three parts of the middle tunic. Whereas the inner tunic is made up of only one layer and this is retina, which is a neural tissue responsible for vision. This is regarding organization of the entire eyeball into three distinct tunics or three distinct layers. Let's learn about the cornea now. As I said, cornea forms the anterior 1/5 of the outer tunic. The cornea, in fact, is the transparent layer that covers your iris. Now, this is what we need to understand. Why only the cornea is transparent whereas sclera is opaque? Now remember, this is very often asked in your exam. What are the causes for the transparency of cornea? Right? Remember, this is because cornea is avascular. Cornea is an avascular structure and it is most often in a dehydrated state. Then the second thing is the arrangement of stroma. The arrangement of fibers in stroma of the cornea. Then the characteristic feature of the ground substance. All these three factors maintain the transparency of the cornea. The junction of cornea and sclera is given a special name. This is referred to as the sclerocorneal junction or referred to as limbus. So limbus refers to the sclerocorneal junction. What is the function of the cornea then? Cornea allows for all the light rays to enter without getting absorbed or reflected because of its transparency. Right? So this is what you need to know regarding cornea. Right? Then, remember, we are not discussing about histology of cornea or histology of sclera or any of the histology of these layers because this will be discussed in separate sessions. Right? Let's focus on the middle tunic now. The middle tunic is also known as the uveal tract. It is a vascular layer. If the outer coat is fibrous, the middle coat is vascular. Right? Now the middle coat has three parts. The first part that we will learn here is this part. And this is referred to as the choroid. Choroid in simple is a vascular tunic. It has a vascular membrane that lies between the sclera on the outside and retina on the inside. Right? The function of choroid is to absorb all the lights. Right? Absorb and it will not allow the light to get reflected. This is regarding choroid in brief. The anterior end of the choroid ends in a thickening and this thickening is referred to as the ciliary body. So this is ciliary body. If choroid is a vascular membrane responsible for absorption of the light and also providing nutrition to the retina, the function of ciliary body is inside the ciliary body there is a muscle called as ciliarus. Why this muscle is important? Remember, this is the muscle which is responsible for the accommodation reflex. What do we mean by accommodation? Whenever you want to read the objects which are close to you, right? The accommodation is very essential. And accommodation, one important muscle bringing this accommodation is ciliarus. This is about the ciliary body. The anterior most part of the middle tunic is referred to as the iris. This is the iris. As I mentioned in the beginning, iris is the one which is responsible for giving color to your eyes, right? So the iris is composed of a central aperture which is referred to as pupil, which will allow the light to pass through. How the iris is made up of? If we take a look at the formation of the iris is made up of two important muscles. As I said, the central aperture is what we refer to as pupil. There is a circular muscle fiber arranged around this pupil, and this is referred to as the constrictor pupillae. This is referred to as what? Constrictor pupillae. Right? One of the intraocular muscle. Then attached to the pupil again, we have one more muscle which is arranged radially in the form of the spokes of a wheel. Right? Now this muscle is referred to as dilator pupillae. These are the two important components of the iris, the two important muscles present in the iris. Why we need to know? Constriction of the constrictor pupillae will cause constriction of the pupil. That is, the pupil will become smaller. If the dilator pupillae contracts, it will bring about mydriasis or dilatation of the pupil. So these are the muscles responsible for miosis and mydriasis. Right? One important or peculiar feature of innervation of these muscles is, remember, the constrictor pupillae is supplied by parasympathetic nerves. Parasympathetic nerves derived from or passing through the oculomotor nerve, whereas the dilator pupillae is supplied by sympathetic nerves. So one is a parasympathetic response and the other one is a sympathetic response. Even though there are other structures that are present in the iris, let's focus on these muscles for time being. Right? This is regarding the anatomy of the middle tunic, including the choroid, which is the posterior part, the ciliary body and the iris, which are present anteriorly. Once we have learned this, the innermost tunic of the eyeball is formed by the retina. If the outermost tunic was fibrous, then the middle tunic was vascular. The innermost tunic is neural. It is composed of neural tissue. The entire retina has two parts. An outer part which has pigment epithelium and the inner part which is neural in nature. Why we need to know this? Whenever there is retinal detachment, it is between these two layers the detachment will occur. Regarding the retina, we need to identify few important landmarks. Retina, as we know, is the innermost tunic. The anteriormost part of the retina undergoes a serrated ending close to the anterior part of the eyeball, and this is known as the ora serrata. It is known as the ora serrata, anterior ragged edges of retina. Posteriorly, if we observe, there is attachment of the optic nerve. Where we have the attachment of the optic nerve, the entire retina is slightly depressed and pale, and this region is known as the region of optic disc. The optic disc represents the site of attachment of optic nerve, as I said, and optic disc is also referred to as physiological blind spot. It is referred to as physiological blind spot. Now, what is the reason for this? We know that the receptors for vision are rods and cones. The rods and cones are characteristically absent in the region of optic disc, and hence it is also referred to as physiological blind spot. The physiological blind spot or the optic disc is present slightly medial to the posterior pole. About 3 millimeters lateral to the optic disc. Right? There is one more area, and this area normally appears yellow in color. So this is also known as the macula. The macula lutea. Right? The macula lutea presents a depression, and that depression is referred to as fovea. Right? The center of the fovea has a further depression, and that depression is referred to as foveola. Right? So what you see here, this is the foveola, the center of fovea. The yellow colored area is what we refer to as macula lutea. Right? Now what is the importance of this? Remember, if rods and cones are absent in optic disc, the foveola is richly filled with cones. It is richly filled with cones. As we know, the functions of rods and cones are, rods are responsible for vision in dim light, whereas cones are responsible for vision in bright light, and they are also responsible for color vision. Right? Since the foveola is richly filled with cones, this is an area of rich discriminative vision. Fine. So you have two distinct regions which are located in the posterior part of the retina. One is physiologically blind and the other one is rich for discriminative vision. This is regarding few of the important features of retina. Of course, histologically retina is made up of 10 layers. Again, we will discuss this further in the histology of the retina. This is regarding retina. Once we have learnt about the three tunics, we need to understand the terms like compartments of the eye or compartments of the eyeball and chambers of the eyeball. Now let's try to understand this. What do we mean by compartments? The entire eye or the globe is divided into two compartments, anterior compartment and posterior compartment. What divides it? It is the lens. So this is the lens which is present in the eyeball, and this divides the entire eyeball into two segments. So what lies behind the lens? This is referred to as the posterior compartment. This is the posterior compartment. Anterior to lens, whatever you have, this is referred to as the anterior compartment. Then what do we mean by the anterior chamber and posterior chamber? Let's try to understand this. Now, what is this structure present in front of the lens? That is the middle layer, the anterior-most layer, which is the iris. Right? Now, if you draw an imaginary line along the iris, whatever lies in front of the iris, this is the anterior chamber. Whatever lies behind the iris and in between the lens, this is the posterior chamber. This is the terms, or this is the difference between the terms anterior compartment and posterior compartment or segments, and anterior chamber and posterior chamber. Remember, the entire eyeball is divided into segments or compartments by the lens, and the entire anterior segment is further divided into anterior chamber and posterior chamber by what structure? By the iris. Right? The posterior segment is entirely filled with a viscous material, and this viscous material is known as the vitreous. Also known as the vitreous humor. It's a jelly which is present in the posterior segment. Similar to this, the anterior segment has aqueous humor, which is more of liquid, and that is responsible for maintaining intraocular pressure. Fine. Any obstruction in the flow of the aqueous humor would result in a clinical condition called as glaucoma. Right? This is what you need to know regarding the compartments or segments of the eye and the chambers of the eye. Right? We discussed that one of the important structures that divides the entire eyeball into two segments or two compartments is the lens. Now let's try to identify the features of the lens. What is lens? Lens is a transparent, it is a transparent biconvex. It's a transparent biconvex structure located within the anterior part of eyeball. Right? The entire eye constitutes of different refractive media, and even lens is one such important refractive media present in the pathway of light. Right? Why we need to know about lens? All of us have heard of a condition called as cataract. Normally, the lens is transparent. When the transparency of the lens is lost, it becomes opaque. It results in a clinical condition referred to as cataract, which would definitely affect the vision. It is one of the cause for reduction or diminution of vision. Right? If you know this much about the lens for now, this would be enough. Right? So this is regarding the anatomy of lens. Once we have learnt about the detailed anatomy, let's try to quickly summarize now. We discussed that the entire eyeball is located within the anterior 2/3 of the orbit, right? And the entire eyeball is made up of three distinct tunics. The outermost tunic, which is referred to as the fibrous tunic, made up of sclera and then cornea. Then comes the middle layer, which is made up of choroid. Then this is ciliary body, and then we have the iris. And finally, we had the innermost tunic, which was formed by retina. Remember, the outer tunic is fibrous and mainly supportive in nature. The middle tunic is vascular, absorbs light and also supports the retina. Then the retina is responsible for vision. It has a neural layer. We also discussed that the entire eyeball is divided into two segments by an imaginary line drawn across the lens. Then, if you draw a line across the iris, this divides the anterior segment into two chambers, anterior chamber and posterior chamber, which is filled with aqueous humor. Then, the posterior segment is filled with a vitreous substance referred to as vitreous jelly or vitreous humor. This is regarding the anatomy of the eyeball in brief. As we mentioned, we will focus on histology of these structures or different tunics in the sessions of histology of the structures of the eyeball or histology of cornea and retina. That's it for this session.